We're not crazy, the system is. Tune in to Madness Radio, voices and visions from outside mental health. Wednesdays, 6 to 7 p.m. Eastern Time on Pacifica affiliate WXOJLP-FM 103.3 Valley Free Radio. Produced by Freedom Center and the Icarus Project, streaming live, podcasting, and archived at madnessradio.net. And today my guest is Philip Dawdy. Philip is a journalist who writes an amazing blog called FuriousSeasons.com. That's FuriousSeasons.com. He's on the line with us from Seattle, Washington. Philip is former staff writer for the Seattle Weekly, which is one of the old Village Voice papers, and has won numerous local and national awards for reporting on mental health. He's been a professional journalist for about 10 years. He also won awards for government and investigative reporting. He's blogging on mental health issues about as part of a book that he's working on, and he's been doing that for about a year and a half, and he's one of the internet sites that hosts the formerly secret, I should say, Ziprasidone files that were leaked from Eli Lilly. So welcome to the show, Philip.
Thank you. Hi.
Thanks for joining us. So I think it's really what I just discovered about you is that you actually were diagnosed with bipolar disorder yourself. Did that play a role in you getting interested in mental health issues as a journalist, or what's the connection there?
Yeah, I was diagnosed in 1989, which was many years before I became a journalist. But yeah, clearly the two things. The stars aligned on this, shall we say. And what was interesting was initially I was working for a paper in Portland, Oregon, actually a really great paper called Willamette Week. And, I talked with my editor there about, why don't I write about this stuff? Because it is a pressing issue in our society, and this was about 7 years ago. And was pretty much told flat no because I was the paper's City Hall reporter, and there was concerns in his mind about me exposing myself, being written off as a nut job, and things going to the level of, the mayor wanting security around when I interviewed her and such. And although I think his concerns were incredibly misplaced, whatever, he's the boss.
Right. Well, the work that you're doing now is just amazing. It's one of the best sites that I've seen following just day by day what's happening on the national and level around the Ziprasidone scandal, around pharmaceutical corruption, the FDA regulations, and there's so much to talk about. But I just want to maybe if you can just give us a little bit of an update of what's going on right now with the Ziprasidone documents, and maybe even starting out with a little bit of a background for people who may not know about that, because I know that there have been some recent developments. I know that there was a story in the New York Times a few days ago.
Right. I mean, there was basically there have been thousands of lawsuits filed against Eli Lilly over alleged injuries and such suffered by patients who'd taken Ziprasidone. Principally, people were alleging diabetes, hyperglycemia, some cardiac problems, et cetera, et cetera. And there were approximately, if I remember correctly, 28,000 of these lawsuits. A whole bunch of them got combined into two separate big class action suits in federal court. And Eli Lilly settled the first of these for about $700 million in the summer of 2005. Very quietly, the media didn't cover it, didn't pick up on it. And apparently, Lilly had to produce a bunch of documents as part of the discovery in the case that eventually forced them to settle this beast. And because, frankly, they were concerned, I'm sure, about getting wiped out at trial. So some of these documents fell into the hands of a man named, whose first name escapes me at the moment, but his name is Dr. Eagleman, and he teaches at Brown University, and he's an expert witness. And quite a few of these documents came into his hands, and he found a way through an attorney in Alaska whose name is Jim Gottstein, who is the head of Psych Rights, who is a very prominent activist in the mental health world, found a way to get him the documents through various legal maneuverings because they were under a court seal. in New York. I mean, the settlement was going to let Lilly keep all its secrets. Well, this didn't sit well with Eagleman. He got these documents to Gottstein, who then got them to Alex Berenson, an investigative reporter at the New York Times, and off Alex Berenson went. And the Times published about 2 or 3 stories in December. One of them about, Lilly basically instructing its sales reps to downplay concerns of side effects with these drugs, such as really explosive weight gain in a pretty good percentage of patients taking it, as well as concerns about blood sugar levels and diabetes. And in addition, he pretty much caught the company off-label marketing Ziprasidone for use in dementia. And just so your listeners know, off-label marketing means that a company would be marketing, i.e. selling, sending the sales reps out to talk to doctors directly, would be selling a drug that was approved for one thing, i.e. schizophrenia or acute bipolar disorder, and selling it for something else, in this case, dementia. And that's not legal. Now, what constitutes marketing is sometimes a really dicey gray area, but certainly directly marketing to doctors by sales reps by the company is forbidden under those circumstances, as it would be to market it directly to consumers for those other purposes, i.e. dementia, depression, etc. And so the documents, this is almost a long story. Eli Lilly's lawyers, an outside firm called Pepper Hamilton in Philadelphia, and it's the same firm that defended them against the Prozac suits in the 1990s. When they found out that these documents had gotten out from under the court's seal, they did a lot of work trying to get an injunction against the people who had them, because apparently some other copies of them had leaked out in the process to other people in the activist community.
Yeah, I was actually one of the people who got a hold of that and ended up being on the ended up being on the list of people that the injunction was against. So I had a gag order against me. It was only lifted recently, just a few weeks ago, actually.
Yeah, and you're pretty familiar with how this played out. And just for your listeners, the scope of these documents are about 4,000 or 5,000 pages altogether, something on that order. And, in all the years of lawsuits around Prozac and Paxil, nothing of this scope has ever leaked out of a court case before.
Well, this is very reminiscent to the Vioxx, the Merck Vioxx scandal in some ways, where there were documents that were leaked and really showed a lot of the same kind of monkeying around with the drug safety studies. Is that right?
Yeah, although a lot of those documents actually came out after Vioxx was pulled from the market and as a result of some of the other class action suits. But yeah, you're right. It's analogous. And frankly, what's interesting is the amount of money that Lilly has now paid out or is going to pay out in settlements on Zyprexa is about $1.2 billion. And if I'm not incorrect, Vioxx's maker has set aside about $1.6 billion to settle lawsuits.
And so Lilly is paying out $1.2 billion before the leaked documents got out.
That's actually, based on it was $700 million before the leaked documents got out, and then about 2 weeks after the documents got leaked out and the Times was reporting on it and the documents were starting to hit the Internet, Lilly settled another series of lawsuits for $500 million, or up to $500 million. That's the amount of money they set aside in their accounting system for it. I assume they're going to have to pay the whole thing out. They won't say. But yeah, it's a whole bunch of money.
Well, I think that's interesting is the context of this, because the kind of the headline grabbing attention is that these documents get leaked and they show some potentially fraudulent criminal behavior, some violations of the law on Eli Lilly's part. But really, there's a larger pharmaceutical industry kind of pattern that's going on here. And one is the fact that these lawsuits have really become a cost of doing business for these pharmaceutical companies. I mean, Lilly knows that it's going to get sued and sort of sets aside a certain amount of money, and then that just goes into the cost, because these are the most expensive kinds of schizophrenia drugs that people can purchase, and they're also like huge profit makers for Eli Lilly. And that's what I think is interesting in reading your blog, is kind of connecting the dots. I mean, you mentioned the Prozac lawsuits that Lilly had faced before. We've been talking about Vioxx. There have also been the lawsuits around Paxil. What do you see sort of the larger pattern here, and what is it that the pharmaceutical industry is facing? Is this a growing scandal? Is this snowballing? Are there indications that this might be the end of the party for the pharmaceutical companies in terms of their big cash-in on psychiatric medications over the years?
I don't know. That's a hard call to make. But basically, for a little over 10 years now, there's been kind of a rolling series of revelations about how pharmaceutical companies have cooked clinical trials data, given quite a bit of money to some psychiatric researchers, and I'm really talking about academic people here, who end up putting out the guidelines that determine what's a diagnosis, as well as, authoring studies and that sort of thing that really don't show a lot of powerful efficacy of some of these drugs. That really started out with the antidepressants, that sort of ball rolling with Prozac, Paxil, and Zoloft in particular.
And I think wasn't it true that a lot of the outcry around the antidepressants really came from England? That's sort of when the first sort of whistleblowers started coming forward and things started to change.
Yeah, I mean the English stuff has really been around Paxil, or Serozat as it's called over there. It has a different name there, same drug. The Paxil stuff really exploded in England. The Prozac stuff was really here, but partially in England. And as a result of a psychiatrist named David Healy, who frankly was somebody who was prescribing Prozac-type antidepressants to patients and running into quite a few problems with them. In particular, something called akathisia, which is internal agitation and internal restlessness, which may sound rather benign to most people, but it's really not. And over time, it can drive someone, I'll use the term advisedly, but it can drive someone crazy, much like, ringing in your ear can over time, too.
Yeah. I've actually experienced akathisia, and it's really an intense kind of restlessness, like you can't quite get out of your skin, but you can't move, but you can't sit still, kind of thing. And it's the driving force that can lead these drugs to be behind suicide and even violent behavior, homicidal behavior as well.
It can certainly influence those things. There's other reasoning on some of the that I don't frankly understand on some of the suicidality that's been connected with or linked with some of the SSRIs, and that's the Prozac class of antidepressants. But there have been pretty consistent reports over the years of suicidal behavior, whether it leads to a suicide or not, around Prozac, Paxil, and Zoloft, and a smaller number of violent episodes that may have been connected with it. I mean, there's a pretty famous case in Hawaii where a man who'd never been violent before gets put on Prozac, and literally within a week he murders his family. And that's pretty dramatic stuff, and that is not the only example of it.
Yeah, I think there was a settlement around Paxil that was very similar as well. It's like a family murder, suicide settlement years ago. Yeah,
there's been a fair number of those things. What kind of distinguishes the Zyprexa stuff is that in all the years that Lilly was getting sued over, Prozac, they only settled $50 million of claims. They were very aggressive. They fought very hard. They never lost at trial in any of the cases that went to trial. Well, here we are, 10 years later, and they're now paying out $1.2 billion when before they were only willing to pay out $50 billion. Tells you quite a bit. In my mind, that tells me that there's big problems with this drug, and Lilly just did not think they could prevail in court.
And they also made a lot of claims about the whole class of atypical antipsychotics, of which Zyprexa is one, and they really kind of sold the whole mental health system, especially the state mental health agencies, on, look, you need to start using your insurance money to cover these atypicals because they're so much better and they don't have the side effects. They're so much safer for clients. And that was one of the things that came out as well, was that actually the studies showed that that's really not true. That was really a marketing thing that Lilly and the other pharmaceutical companies were pushing. That actually,
well, to be fair to the pharmaceutical companies, first of all, it's not just Lilly who was doing that. It's been Johnson & Johnson doing it just as much with its drug Risperidone, as well as AstraZeneca with Seroquel. And in the mid-'90s, when these drugs really first started to hit the world and were being used pretty much just for people with schizophrenia, they produced much fewer side effects than the older first-generation antipsychotics like Thorazine or Haldol. And you didn't have people getting zombieism and shuffling feet and frozen faces and all that. And that alone was considered, a miracle by a lot of doctors. And that's kind of the press that got out. I think, frankly, it was being generated as much by doctors as the pharmaceutical companies. They really thought they had the silver bullet here. They had drugs that seemed to work better on treating the symptoms of schizophrenia, and they had drugs that had a completely reduced side effect profile. And over the next few years, it really took until about 2000 or the early 2000s until you see in the clinical literature that doctors are all of a sudden saying, whoa, we're seeing cases of diabetes popping up. Now, those had been, the pharmaceutical companies, and Lilly in particular, had been getting warned about this in the late 1990s from doctors. For instance, the Zyprexa documents contain a letter from a physician with, I believe, Ventura County in California's mental health system saying, hey, we're getting cases of diabetes and just explosive blood sugars in our patients here, so, we're really scaling back the use of our drug. And, you were seeing similar sorts of things with some of the other atypicals. And what's significant about this is it's right around 2000 when the companies started making a really big push for their drugs to be used, and these are the atypicals I'm talking about, in bipolar disorder. And what's interesting there is classically in treating bipolar disorder, you give somebody a mood stabilizer, lithium, Depakote, those are really the two biggies, and now Lamictal, and maybe an antidepressant to treat the depressive side of things. And that was pretty much what you had to work with. And if somebody got really agitated or really manic or just had some pretty rough hypomania and couldn't sleep, which is, prototypical with bipolar disorder, a doctor would often give them a small prescription of one of the old antipsychotics. Mellaril was very popular for this because that was a much softer antipsychotic than Haldol or Thorazine. And the basic drill was that a patient would take it for 2 or 3 days at a pretty small dose and get to sleep and knock down whatever the heck was going on. And all of a sudden, we had these drugs, and these are now the atypicals like Zyprexa and Risperidone and Seroquel. We had these drugs being pushed pretty aggressively on doctors with a wink and a nod that they needed to be giving these to their bipolar patients instead of the older ones. But the benefit here was that people could take them every day because they had no side effects, and they worked so much better than the older antipsychotics, and this would prevent the recurrence of, agitation, insomnia, et cetera, as well as full-blown mania. And that's where, right around 2000, a lot of people who had bipolar disorder started getting these drugs and taking them long-term. And I was one of them. And, this was a huge paradigm shift in treating bipolar disorder. And it was one that the pharmaceutical companies pushed pretty hard. Whether that was legal or illegal is really up to someone else to determine, because the drugs were approved for acute mania, which means they could be used short-term for treating mania/bipolar disorder. But when you get into longer-term use, that's something that the doctor is supposed to, decide upon. And doctors are very prejudiced, and psychiatrists are very prejudiced that if somebody comes in with symptoms, and I'm not talking about a brand new patient, first diagnosis, first episode of mania sort of thing. I'm talking about a patient who's, in a long-term situation. And they come in with what are called breakthrough symptoms. They're getting a little manic, they're getting agitated, they're getting badly depressed, et cetera, et cetera. A doctor is either going to switch them to a different set of meds or increase the dosage of whatever they're taking. Patient comes back a week or two later, their symptoms are knocked down. There are very few doctors who would then say, okay, well, I'm going to back you off those medications and let's get back to your baseline and see where we're at. The doctors will almost always leave you on whatever new medication you got put on, or leave you at the increased dosage and just let you go along. And that's a really interesting way of doing medicine as far as I'm concerned. But again, that was, part of the dynamic that was going on, and the pharmaceutical companies knew it, and the doctors knew it too. And that's why you had millions of people who did not have schizophrenia ending up on these drugs long term. In addition, the pharmaceutical companies realized that, okay, these drugs, we can, get doctors to use them to treat any sort of, psychological condition that, involved a little combativeness, agitation, et cetera, et cetera. And, of course, that led right to dementia.
Yeah, I think Alzheimer's,
those
patients
are,
as well.
kissing cousins there.
Yeah.
And so you've got, I don't think it ever got used in dementia to quite the degree it's been used in bipolar disorder, but it certainly was pushed there. None of these drugs, the entire class of atypicals, of which there's 6 drugs, none of them, to the best of my knowledge, are approved for dementia. And in fact, I believe some of them now have a black box warning on them, which is the FDA's most aggressive warning on a drug, saying that they should not be used in elderly patients because of increased death risk.
Yeah, there was also part of that whole dynamic from 2000 to now was an explosion of marketing to children. That it used to be that kids didn't get severe mental illness diagnosis. It was sort of considered, you're young, you're developing, your personality is still shaping, and now we're getting, pre-teens and toddlers.
Well, yeah,
bipolar.
Let's delineate this pretty carefully.
Yeah.
It really was only around 1990 and really, frankly, 92, 93 that you started seeing teenagers, really 14 years and older, getting a lot of psychiatric diagnoses, ADHD, depression, bipolar disorder, although it was really either depression or ADHD at the time. And I think we all know that the wave of prescribing kids Ritalin or teenagers Ritalin or prescribing teenagers Paxil just did not work out very well. Well, shift to the 2000s, and in the early 2000s, you see the same set of teens or the same loose set of teens being diagnosed with bipolar disorder, and over the last 5 or 6 years, they keep pushing that diagnosis and the treatment paradigm down to younger and younger age groups, and they have researchers claiming, oh, no, bipolar disorder can exist in somebody as young as 2 years old. and we're going to diagnose it at that age, and we're going to medicate these kids. And by gosh, you have kids who have ended up on Zyprexa, Risperidone, and Seroquel. And as an older patient, I have a really hard time seeing how you can give drugs, particularly long-term, that cause a lot of problems in adults to 2-year-olds, 4-year-olds, 6-year-olds, what have you.
Wasn't
in very
there
extreme cases, I could see the case for this. In really difficult cases of autism, in particular, where you have, kids just smashing up houses and stuff, I can understand why you would want to do it. But otherwise, diagnosing kids with bipolar disorder at 3 years old and sticking them on Seroquel just does not strike me as being a very good idea.
Yeah, there was recently a death of a 4-year-old kid here in Massachusetts.
Rebecca Riley.
Yeah, and I guess
that's going to be a complicated case of whether
they originally
her
went
being medicated at all, and her diagnoses that she got of bipolar disorder and ADHD at 2 years
at
old,
age
whether
2,
that drove her death or whether her parents just over-medicated her to death.
Yeah.
That's something that's just going to have to come out.
Well, there might also be a combination of the two. I mean, it seems like there's a real irresponsibility on the psychiatrist's end of providing the drugs to begin with, and then the whole question of what did the parents do with them. I mean, I wasn't there. Obviously, this is going to come out, I guess, in a trial when this goes to court. But it's just it's interesting. You mentioned before the appeal of the atypicals, and I definitely know people. I haven't actually been on any atypical Seroquel or any of the Zyprexa or any of the atypical antipsychotics, but I do know people who have, and some of them do report that they like them, they like them better, and the side effect profile is definitely different. And interesting, because I had Robert Whitaker on the show not too long ago, and we were talking about this, and he was saying that it's interesting because the actual standard of care for the atypicals is to use a smaller dose. So it may be that as part of promoting these drugs, they were also promoting smaller doses that were being used with the Haldol and Mellaril and Stelazine of the older drugs. That might also be accounting for the fact that
to a degree. Now, here we've got to kind of separate out schizophrenia from other psych conditions. And with schizophrenia, the doses may have been a bit smaller if you're looking at equivalence between first and second generation antipsychotics. Clearly with bipolar disorder, for longer-term use, they were definitely getting into the hands of patients at much smaller doses than a schizophrenic would see it. For instance, with Risperidone, a schizophrenic might get 3, 4, 5 milligrams a day of Risperidone. Somebody with bipolar disorder might get a half a milligram or 1 milligram.
Interesting. So let's. And
by the way, I did want to point out very quickly that I think some of your friends are right. There are people for whom these drugs work profoundly well, particularly right soon after they start taking them. They're like the perfect drug initially if people respond to them very well. And some people at low dose respond to these very well over time, and that's great. Go right ahead and take them. But we're almost chasing this sort of lifestyle perfect feeling that's been sold to us in our culture, not just by pharmaceutical companies, frankly, but by medical doctors and public health officials and so on. And we've been chasing perfect feeling as a culture for probably 20 years.
Yeah, it's really coming out in the television advertising now. You're sort of got these images of these people dancing on the beach and playing frisbee with their dogs and how wonderful the life is, and this image of this is what we all deserve. And it's a very Brave New World kind of side to it. And I think also, one of the appeals of the atypicals is that the previous generation of drugs, I mean, I've been on Mellaril and Trilofan. Those are really, really horrible to a lot of people. I had really
Oh,
bad
yeah.
side effects. I mean, when I was on Mellaril in the hospital, I mean, I had no cognitive ability. I wasn't able to carry on a conversation. I mean, they just was like, it was a chemical lobotomy. And I think a lot of that has to do with the dosage and how, I was being treated by the people around me at the time who weren't aware of what I was going through. But I could definitely see how folks, one of the things that we work with at the Freedom Center is really encouraging people that, hey, if your meds aren't working and, you feel like you need them, one thing to do is to talk about changing them and exploring them.
Yeah.
And also I think that there's a big placebo effect here too, because the atypicals and the new generation and this kind of thing, there's an expectation that they're going to work better. But I wanted to go back to the whole situation with where the Zyprexa scandal has led to, because you mentioned earlier that there are now some congressional investigations going on. I know also that some of the states are starting to open up
Right.
investigations. Can you tell us something about that?
Well, there are 7 states who are now suing Eli Lilly over various aspects of the marketing of Zyprexa. Basically, kind of the broad set of accusations are that they were pushing the states very hard to get it into their state Medicaid programs for dementia and bipolar disorder, but particularly dementia, when there was no indication for it from the FDA, and yet states spent tens of millions of dollars a year on this, and frankly have had some long-term consequences for patients that the state Medicaid systems are going to have to pay for now. And 7 states have sued at this point, and I can't tick them all off, but what's interesting is Montana's recent lawsuit, which I read the complaint of, is alleging that Eli Lilly was paying kickbacks to doctors, and, which is just startling, I think, to anybody that doctors would accept kickbacks. And, was not just wining and dining them on a very casual local level, but was flying them to conferences at exotic places and taking them sport fishing and, putting them up in first-class hotels and, giving them first-class plane tickets, et cetera, because these would be the key influencers who would decide, what drug gets used and, with what kinds of patients. So those are kind of the broad set of accusations you'll see from these state lawsuits. I've got sources out there who tell me that there's going to be other states suing in the very near future.
Any chance that Massachusetts would be joining that bandwagon?
I would be surprised, frankly, if Massachusetts, California, which is investigating Zyprexa, I think currently, but hasn't filed a suit, Washington State, Texas, places like that, the big states with the big Medicaid systems, if they didn't follow suit.
Yeah, because the schizophrenia drugs and bipolar drugs are a huge portion of the state Medicare budget. Is that right?
Yeah, state it's generally Zyprexa, Seroquel, Risperidone, which are pretty heavily used in state Medicaid programs, are literally the top costing pharmacy items they've got in terms of what the states pay out each year. I believe the state of Washington, and I believe the year on this is 2004, they spent $100 million in the state Medicaid program on atypical antipsychotics, and about 90% of that was for atypicals.
Just on pills. It's incredible, because when we think about mental health, we think about something, it's like this thing in the shadows, in the corner, but it's actually one of the central healthcare issues in the country in terms of spending, in terms of economics, in terms of politics, is what kinds of treatments that we provide people who end up having experiences that get labeled with schizophrenia or bipolar. So what's happening on the federal level with the congressional hearings?
Yeah, to go to that, when these there seem to be 2 things that have spurred a congressional investigation of Eli Lilly's Zyprexa and AstraZeneca's Seroquel, and one is back in the fall of last year, the FDA issued some kind of ruling or warning to AstraZeneca that it was improperly stating some side effects in its marketing literature of Seroquel, and it forced them to correct that.
I think that might also be called a cover-up, wouldn't it?
Well, I don't know. That one's a little difficult to assess. I'm going to wait and see what Congress comes out with on that before I make my own decision on it. But yeah, for the FDA to do that tells you something was up. And then about 6 weeks later is when the Zyprexa story started breaking in the New York Times. And both of those events, as well as kind of the news that kept spilling out around the Zyprexa documents, as well as the Democrats, gaining control of both houses,
right? Because
has led a congressional committee which is chaired by Henry Waxman,
the
who's
pharmaceutical
a U.S. representative from the Los Angeles area.
Yeah, the pharmaceutical companies tend to favor the Republican Party, I guess, and the Bush family is very heavily tied into Eli Lilly, and so in some ways, it's like healthcare in general. It can be like a partisan kind of issue.
I suppose it can be. The thing that's interesting here is Waxman was the guy who was chairing a congressional committee back in the earlier mid-'90s, and he's the guy who brought the tobacco companies in and made them raise their hand and basically called them criminals to their face.
Interesting. And then also one of the FDA whistleblowers on Vioxx has come forward, is now talking about the atypicals as well, right?
And I want to let me finish one thing on the congressional part.
Yeah.
They requested reams of documents from both Lilly and AstraZeneca, and those, I believe, the deadline for the companies to comply with what is technically a request. It's not a subpoena, although I think it would turn into a subpoena if the companies failed to comply. Their deadline was last week, and we'll see what's coming down the road. There's a few other drugs and a couple of medical devices that the committee is looking at as well. I think what you're going to see here is a period of a couple of months where the committee sifts through these, or their staffers, I should say, sift through these documents and try to decide what's there, and then they'll figure out whether they're going to hold congressional hearings, and if so, when they'll be. And I suspect they're going to go forward with this. There would be no reason for them to, request reams of documents if they weren't darn serious about doing something. And frankly, this is an issue that could, be a political win for the Democrats, who, with the war going on and them being put in a very awkward position of criticizing and half supporting it at the same time, they may need all the wins they can get with voters for 2008. So that's kind of where the congressional investigation is going right now. Who the heck knows where it's going to lead? It's impossible to say. Republicans tend to be when they're in control, they tend to be a little less interested in looking into these kinds of things. And sure, the pharma companies give a lot of money to Republicans, but they give a heck of a lot of money to Democrats.
Yeah, they hedge their bets. The oil companies are like that too. But I think it's about 2-1 Republicans to Democrats.
Yeah, that wouldn't surprise me. I'm not sure how tight the connection is between the Bushes and the Eli Lilly company these days. Back in the 70s, George H.W. Bush, and that would be the first President Bush, was on the board of Eli Lilly, just a few years before he became Vice President of the United States. And there was a budget director under George W. Bush who had worked for Lilly. He had been, I believe, some kind of vice president of something. And so these kind of connections have always been there. How much they influence policy and how people do things and enforcement, I don't know. The other bit you just mentioned there, you're referring to David Graham, who's a safety official with the FDA. And last month he went before a congressional subcommittee, a House subcommittee, and basically said, look, we've known there's problems with Zyprexa for several years. The FDA has been very concerned, and this is going to merit a much stronger look-see from the FDA. Now, he was speaking apparently on behalf of several other FDA safety officials who, frankly, were scared to come forward. And Graham was there speaking as a private citizen, not as an FDA official. Apparently he took the day off. And when I, of course, tried to track him down through the FDA, they refused to put me in touch with him because he had spoken as a private citizen. But I suspect he is going to find a way to, at least from the FDA side, whether it's internally or externally, to keep the heat on. And yes, for David Graham to come out and kind of put his name on the, not on any real direct accusations, but on, hey, look, there's problems with these drugs and we need to look into it. For him to come and put his stamp on that, when the only other thing he's been that outspoken about was Vioxx, that tells you something.
Yeah, and this, it raises kind of the larger issue, and it's one of the reasons, Philip, that I love your blog. It's furiousseasons.com. If people aren't familiar with it, just that you're just following so many different threads to the mental health industry story. And one of the big news items recently was that there was a big article in the New York Times Magazine about the Hearing Voices Network in England. And if people don't know about this, we talk about this a lot at the Freedom Center. This is something that we really want people to know about. There's a big international movement of people learning how to cope with auditory hallucinations through support groups, through cognitive techniques, through talking back to the voices, through all these different tools. There's a lot of alternative research into the success and effectiveness of these techniques, which is kind of really flies in the face of the medical approach, which is just like, well, if you're hearing voices, if you're having auditory hallucinations, then you must have faulty brain chemistry, and therefore medication is really the only way to go. And that's one of the reasons we've been trying to just get the word out that, wow, there's this whole movement in Europe that is really challenging that. And it was pretty exciting to see the New York Times pick that up and say, hey, look at this. Actually, people are effectively dealing with what's considered like the sort of the definition of schizophrenia in some ways, and at least psychosis, without medication, and doing it very effectively. And there's a lot of innovative research that just because you hear voices doesn't mean that you're crazy. And,
right.
And I guess it sort of raises the larger issue here, which I think is what most interests me, is that how is the pharmaceutical company and biomedical kind of stranglehold that we've experienced for about 20 years on what's the best way to deal with mental illness, what is mental illness, who should be making these decisions, and is that stranglehold starting to loosen up a bit? Are we seeing some of the corruption start to be exposed? Are people who have more holistic perspectives, more psychological rather than medical perspectives, is that starting to come forward? Is there a real sea change happening with mental health right now, which I mean, I hope the answer is yes, but I'm wondering what your assessment is.
I think my assessment of this is that you're starting to see the pushback and the recognition among patients, particularly patients who've been told they have chronic lifetime conditions, and who've in some cases either been medicated into oblivion or just continue running into medications that work for a month and then break down, and it's just like, well, why would I continue taking this? Why would I continue getting dosed up each time? And you're starting to see this recognition among some patients who are aware of these sorts of issues or are not afraid to ask these sort of questions. I don't think it's from enough patients. It needs to be coming from more people. I think at some point here we're probably going to see a bit of a paradigm shift back to more psychological methods. How holistic that'll all be, I don't know, but cognitive behavioral therapy, CBT as it's known, was developed in this country. One of the prime architects of it is a psychiatrist, quite ironically named Aaron T. Beck, who I've forgotten the name of the book. Well, he's written several books, but there's one that's quite famous. I think it's The Road Not Taken or The Road Taken or something like that. But, hopefully at some point before he becomes too elderly, he's going to get a Nobel Prize in medicine, because in England they've done study after study using CBT on depression and found out that it can be, and it depends on the patient, of course, they've found that it can be as effective as antidepressants and cost much less, and frankly, you only need to do it for about 3 months. It's not like you have to take antidepressants for the rest of your life. they're also finding that it has some impact with some schizophrenics or voice hearers, if you want to use that term. Not necessarily everyone, and not necessarily to the same degree. What we call schizophrenia in our culture is a pretty complicated equation to work with medically, psychologically, et cetera. But I think we are starting to see a growing recognition in this country that, bottom line is that the psychopharmacological revolution ain't working out so well. It's costing us tons of money, $40 billion a year approximately in this country, just on the drugs. And it's like, well, what results do we have to show for it? Does anyone really feel that much better? Have our lives been revolutionized? Has the rate of suicide gone down? And, well, frankly, the rate of suicide hasn't changed very much in 50 years. And, I don't really think that many people are feeling that much better. Obviously, there's places where, I think psych meds that are made by pharmaceutical companies are profoundly valuable, particularly in short-term crises with depression and bipolar disorder. Some of these medications can very effectively knock down big, bad, suicidal problems.
Especially when you've got people who haven't slept for days and days,
right.
And that's driving these.
Sleep is a gigantic issue.
It's a huge issue. I mean,
it's a huge issue in our culture. It's
a
huge issue with psychology and mental illness. And frankly, if you scratch the surface of anybody who's been diagnosed with bipolar disorder or depression, or what have you, you're going to find somebody who's had some big chronic sleep problems.
And then ironically, a lot of the drugs that are given for the sleep also long-term cause sleep problems. So how far do you think the scandals are going to go? I mean, is Eli Lilly seems pretty prepared to deal with this kind of expose, judging at how they handled the Prozac situation and the settlements that they did with Zyprexa. But I'm wondering, how far do you think this is going to go? I mean, how far are the Democrats prepared to take this? Where is Waxman headed with these investigations, and what can we kind of expect in the the next few months?
I don't know where Waxman is headed per se. Waxman is a very smart political animal. He's been around for a long time, and he's not going to use his political capital on something like this, withholding hearings and the investment of time, unless he's got a very serious place to go. The problem is it's pretty hard to assess that right now, because when investigations are ongoing, Congress, as well as any agency that's doing an investigation, is very tight-lipped about what it's doing. And that's fine. I'm perfectly willing to let them be tight-lipped about what they're doing. We're going to see more come out of all of this. There is a class action lawsuit in federal court that's just sort of in the preliminary stages, well in advance of trial, in a federal district court in Orlando, Florida, involving Seroquel, and I believe it's 10,000 patients. And I think at some point we're going to see interesting news out of that, or a big settlement, or a big trial, that goes on for 6 months or something. There's lawsuits around Risperidone. In particular, the state of Texas is taking on Johnson & Johnson over how Risperidone, or how the company may have, illegally, or at least dramatically, unethically influenced Risperidone's inclusion in this set of guidelines that the state of Texas's Medicaid program came up with, called the TMAP, the Texas Medication Algorithm Project, which has, of course, been adopted by many other states, where it basically tells you, well, start out with this drug with somebody and then switch to this drug and then switch to that drug. And it's supposed to be this big, as the term algorithm might imply, it's supposed to be this scientific equation. Well, it wasn't scientific at all, according to the state of Texas lawsuit. I mean, it involved, quite a bit of chicanery.
It ended
allegedly. So we're going to continue to see this sort of thing. I think this is going to continue to roll out for another couple of years at least. And it's really going to depend on how much the mainstream media is willing to pay attention to it and treat it as a serious, important issue. And this is where, frankly, I know the Pacifica audience and the Freedom Center world and Icarus and so on and so forth tend to be a lot more lefty than most people and really think the mainstream media is one of the great evils of the universe. But I've got to tell you, this is a place where the New York Times, much to their credit, I have watched them in the last 2 to 3 years become a lot more skeptical in their mental health coverage. And, I think the Ziprasidone thing is really indicative of this. They've started to write skeptically about antidepressants. They ran the big article in the magazine, which is, of course, separate from the news side of the paper. But they ran that big article on the Hearing Voices Network, which I think was just spectacular. They've also had articles in the main news section of the paper about, people using non-medication therapies to address schizophrenia.
Yeah, actually, I was actually interviewed in that article, and so Ben Carey, I definitely, and I think actually when Alex Berenson, when the articles first came out about Zyprexa, the Times was very quick to call for congressional investigation. So I think I don't think that the mainstream media is monolithic, but I do know that they've had taken a long time to cover things like the Hearing Voices Network, and I know that the main study that was done showing that a lot of people diagnosed with schizophrenia do better without medication. That study has been around for quite a while, and the New York Times hasn't quite picked up on it. So there's definitely a way in which there is an inertia. There's definitely like a status quo that's operating here, but I don't think it's monolithic. And I think you're right. I mean, I think that the Berenson and Ben Carey have really been pushing beyond the kind of standard message that you tend to be getting, which is more in accordance with the medical and pharmaceutical.
Yeah, it's a lot more nuanced, and frankly, you look at the other coast where the other big paper with Times in its name is, and that's the L.A. Times. And that paper seems to be doing everything it can in either editorials or news articles to argue for forced medication of schizophrenics.
Yeah.
And of the homeless. I mean, they won a Pulitzer 5 years ago or something like that for a series of editorials, basically calling for the homeless to be forcibly medicated because it's so much better for them. And it's just like that. It's just an incredible amount of arrogance on their part. Whatever anybody thinks of forced medication, it's like, they don't even counterbalance what they write with any sort of information on, well, why the heck do some patients go off their meds? And really, how well do these meds perform in the real world? Because as, we've got a long-term study out of England now at the University of Manchester, as well as the much more famous CATIE study, as it's called in this country, which was funded by the National Institute of Mental Health. So both of these studies were independent of pharmaceutical companies, and they show that these second-generation antipsychotics, the atypicals like Zyprexa, don't, in terms of clinical measures, don't perform much better than the older antipsychotics, yet they cost anywhere from 8 to 20 times as much. And in addition, that we've really just given, and this really applies to schizophrenics, that we've really given schizophrenics a new set of side effects to contend with, which would be, blood sugar problems, weight gain, et cetera, whereas with the older antipsychotics, most of the issues were around movement disorders and cognitive problems, i.e. turning people into zombies and making their brains virtually non-functional. And I think, frankly, what I've sort of picked up on anecdotally from interviewing patients, and in particular schizophrenics, and spending a lot of time around them, is the ones who are on fairly high doses of the newer antipsychotics, they do the shuffling, they get a little zombieism, and they have cognitive problems too. It's not universal across them, but I certainly see it happening to a degree that I was a bit surprised by when I started running into it a few years ago. And frankly, there are people with bipolar disorder who have taken drugs like Seroquel or Risperidone or Zyprexa at lower doses, perhaps half to a third of what a schizophrenic would take, who have run into problems with movement disorders, facial tics, their mouths moving, and in the case of, frankly, myself with Risperidone, after about 2 years of taking the drug, it started freezing my face up. There was like no emotive quality playing on my face, as a friend of mine articulated it very well, and that's kind of freaky because those drugs, A, aren't supposed to be doing it, B, shouldn't be doing it at the doses people are taking it at, and C, it completely argues against the justification for bipolars taking these things long-term as some kind of alleged mood stabilizer like lithium. Well, if they have no side effects or they have very limited side effects, great. But if we start seeing the same set of movement disorders that everybody was scared about with the old antipsychotics, then we've got a problem here. And we've got a paradigm that has got some real issues. And then there's some other atypical antipsychotics which are used a bit less. One is called Abilify. The other is called Geodon. And both of those are now, Geodon in particular, become quite infamous for akathisia. And, there are people who've gone on Geodon after, Ziprasidone or Seroquel or whatever didn't work, and just found themselves literally thrown into mania for 2 or 3 weeks before they can figure out that it's the drug and not them.
Yeah, that's exactly what happened to a Freedom Center organizer who she had a very serious, what could be described as a manic episode, just kind of escalated. She got worse and worse. Goes in the hospital, comes out of the hospital, and she was calmer, but she was still in her manic state. Her personality was not there, and everyone was really worried about her because it's just like nobody's home kind of thing. And then a few weeks later, she came out of it and she was back and she was like the person that we recognize. And what had happened was that when she came out of the hospital, she was on Geodon. The Geodon was actually kind of keeping her in that kind of manic state in a weird way. And then as soon as she got off of it, from her own initiative, by the way, not anybody monitoring her doctor, she came out of it and was able to come down. So there's a lot that we don't necessarily get told about these drugs when people are.
Well, they don't want to tell us about that because doctors will prescribe them less and patients will trust their doctors less. And, the things I am saying to you on here and the questions you're asking me and the things you're saying, somebody like Eli Lilly or AstraZeneca, and they have done this in the past, will construe this and publicly spin this as, they're just trying to scare people off their medication. Well, that's not true.
It's not true.
What I'm trying to offer.
That's the message that's the response we often get at the Freedom Centers. Oh, you're just anti-medication. You're on No, we're trying to, provide some accurate information.
I think we've all come to realize that this is a much more nuanced issue than than any of us would have thought 10 years ago.
When she came out of the hospital, no one tried to convince her to go off of her medication. I mean, she had to discover herself and to get some feedback from people about the state that she was in. And maybe she should experiment. Like, maybe I should try going off and see what happens. And she went off the Geodon, and lo and behold, she got better. So, Philip, this has been a great interview. I'm very sorry that we're running out of time here. I just wanted to give you a couple minutes to wrap up. If you had any other comments or any resources that you wanted to offer. I know that your blog is furiousseasons.com. It's one of the best things on the internet around mental health and the pharmaceutical companies. So definitely check it out, furiousseasons.com. But do you have any last words?
Well, I think, first of all, as far as other resources go, I think if people visit my blog, they'll see a bunch of links. There's some other good writing out there on mental health, and some of it, frankly, being done by academics in the field anonymously because they're scared to death of using their name. That could cause them some problems, particularly if they don't have tenure, because, frankly, the psych departments at most big universities are deeply tied in with the pharmaceutical companies. As part of you're right, this is all these issues are huge, and they're massive in our culture these days. And I think where we're headed with all of this, forget about scandals, forget about pharmaceutical companies allegedly doing bad things or, frankly, just doing bad things. Forget about all of that for a minute. I think what we're starting to see, and and I've really got to credit the Freedom Center and Icarus Project on this quite a bit. And, I guess my own realization fits in with this, as does that of some other groups like Mind Freedom and Psych Rights, and frankly, advocacy groups like Mental Health America, which are a little more skeptical than the NAMIs of the world. What you're starting to see emerge here is that patients are becoming a heck of a lot more skeptical of how this all works. They're, I think, going to be a lot more resistant to a drug becoming the answer to any psychological issue. I mean, if things get bad enough, go right ahead, take a med, and let's see what happens. But I think what's going to happen is patients are eventually going to push this game back in the direction where you're not just working on the outside of yourself, you're working on the inside of yourself. And, kind of the recognition that we've got a heck of a lot more control over how we feel and behave, even in terms of talking about mania or something like that, than any of the researchers will say. Because if they say that, they lose their power. And the paradigm of, the biochemical imbalance in your brain begins to lose its power, too. And that's going to cost somebody a lot of money and a lot of prestige. But this is something that real, live human beings need to push back on, and they need to not be scared to open their mouths and say this stuff publicly. Because too many people just go crawl off in the corner, and it's like, well, I can't say that because I'm going to lose my job, or I can't say that because that girl's not going to date me tonight, or whatever, or my boss will think I'm crazy. People are going to have to start speaking up. I've very publicly outed myself in a newspaper in Seattle 3.5 years ago almost, and I thought I was going to destroy my career as a journalist, but I also felt I had an obligation to tell the truth to the public, and it's the best thing I ever did.
Philip Dawdy, thank you so much for joining us on Madness Radio.
Thanks for having me.
And that's all the time we have this week. You've been listening to an interview with Philip Dawdy. Philip is a journalist who has written for the Seattle Weekly and won a number of awards for his coverage of mental health issues. He authors the blog FuriousSeasons.com. You can check it out. We're not crazy, the system is. Tune in to Madness Radio, Voices and Visions from Outside Mental Health, Wednesdays 6 to 7 p.m. Eastern Time on Pacifica affiliate WXOJLP-FM 103.3 Valley Free Radio. Produced by Freedom Center and the Icarus Project, streaming live, podcasting, and archived at madnessradio.net.